Hello everyone, my name is Zhu Xinwang. I am a physician of the nephrology department, the first affiliated hospital of our school. Today we will briefly discuss the urinary tract infection, abbreviated to UTI. The urinary tract infection in adults can be categorized into 5 groups: women with acute amplificated cystitis, women with recurrent cystitis, and women with acute uncomplicated pyelonephritis, complicated UTI, and asymptomatic bacteriuria. The epidemiology. We all know that the urinary tract system includes the kidney, the renal pelvis, the ureter, the urinary bladder, and the urethra. The epidemiology. Acute uncomplicated UTIs are extremely common. The incidence of cystitis in sexually active young women is about 0.5 per 1 person year. The incidence of pyelonephritis in young women is about 3 per 1,000 person years. The self-reported incidence of symptomatic UTI in postmenopausal women is about 10% per year. The incidence of symptomatic UTI in adult men younger than 50 years is much lower than in women. The pathogen of UTI. Uncomplicated upper and lower UTI are most common caused by E. coli, present in 70% to 95%, and Staphylococcus present in 5% to more than 20%. Other organisms are less common. A broader range of bacteria can cause complicated UTI, and many are resistant to broad-spectrum antimicrobial agents. The route of infection. Most uncomplicated UTIs in healthy women result when uropathogens, and typically E. coli, present in the rectal flora, enter the bladder through the urethra after an interim phase of periurethral and distal urethral colonization. The pathogenicity. The virulence determinants include adherence factors, toxins, immune evasion, iron acquisition, flagellar and serum resistance. The host defense. Many host behavior, genetic, and biologic factors predispose healthy young women to uncomplicated UTI. Factors protecting individuals from UTI include the host immune response, maintenance of normal vaginal flora, which protects against colonization with uropathogens, and removal of bladder bacteriuria by micturition. Risk factor. Factors affecting the large difference in UTI prevalence between men and women include the greater distance between the anus and the urethra matters, the drier environment surrounding the male urethra, and the greater length of the male urethra. UTIs are more likely to become complicated in the setting of impaired host defense, as occurs with indwelling catheter use, vasculoureteral reflex, obstruction, neutropenia, and immune deficiency. The manifestations of cystitis. Women with acute uncomplicated cystitis generally present with acute onset of dysuria, frequency, urgency, and suprapubic pain. The acute pyelonephritis is suggested by fever, chills, flank pain, nausea and vomiting, and costovertebral angle tenderness. Cystitis symptoms are variably present. Symptoms may vary from a mild illness to a sepsis syndrome, with or without stroke and renal failure. The complicated infections. Patients with complicated UTI may present with classic signs of cystitis and pyelonephritis, but also may have vague or non-specific symptoms such as fatigue, irritability, nausea, headache, and abdominal or back pain. Non-invasive tools to localize infections to the kidney or prostate are lacking. Asymptomatic bacteriuria, also called covert infection. there is significant bacteriuria, but the patient is asymptomatic. The pathogen is usually E. coli, and asymptomatic bacteriuria often appear in older and pregnant people. That's all for today. Thank you for your time.